Hey everyone, it's FERN and Grumpy, and today we're going to be talking about Chicago Med.
Noah? Paramedics just called. I got a guy over on Chicago Avenue with some sort of cardiac event. All my attendings are tied up. Was hoping that you two could handle it.
How long until they land?
They're not. I need you two to get over there. Guy's refusing to get in the ambo.
Hold on, you're telling me that all the attendings are tied up, but a resident and a nurse are free? Okay, name a less likely scenario, am I right?
Yeah, that's pretty accurate. What exactly was she asking them to do again?
Was hoping that you two could handle it.
How long until they land?
They're not. I need you two to get over there. Guy's refusing to get in the ambo.
I'm sorry. Unless they've nicknamed the Trauma Bay or the Waiting Room Chicago Ave, I'm not going to get a patient.
Beautiful. This is the skin of a killer.
Yeah, catch me inside where I'm paid to work.
Just so everybody knows out there, if you refuse to get into an ambulance, that's okay. That's your choice. No one's going to make you, and we're not coming to get you.
Yeah, I have 20 patients waiting to be seen.
Hey, Courtney, what's going on?
Hey, got here about half hour ago. He refused to get in the ambo. Name's Larry Simpson. Cardiologist put him on Digoxin. He mixed up his meds this morning, took a triple dose.
All right, we'll take it from here. Stand by.
Hey, Larry, I'm April. This is Dr. Sexton.
Oh, thank God. Please help me.
So that's what happened.
Started feeling faint on my way into work. I called my cardiologist. He said to find a way to keep my heart rate up and call 911.
Let's recap what we know so far.
So this gentleman took 3 times the normal dose of Digoxin.
He felt faint and called his cardiologist.
His cardiologist recommended he find a way to keep his heart rate up. He then called 911.
And here we are in the street. So, Dr. Grumpy, tell us a little bit more about Digoxin.
Digoxin's a medication in the cardioactive glycoside class, so they're primarily used for certain tachyarrhythmias and in heart failure due to systolic dysfunction. That's a lot of big words to say that usually they're used for cardiac conditions. Most commonly, you're going to see them prescribed by a cardiologist to control atrial fibrillation. This class of medications primarily inhibits the sodium-potassium ATPase channels, which overall is something that's going to increase contractility in the heart, but they also change vagal tone in the body, which slows the heart down. All that means is they have kind of complex interactions in the body that can make a lot of different symptoms occur if there's a problem with them. So with what we just learned, why is this bad? There's a very narrow therapeutic window for how this medication works. And what a therapeutic window is when you have not enough, it's not going to work. When you have too much, it's going to be toxic. And then there's this small space in between where it's just the right amount of medication to get the effect that you want. This all begs the question, what does Digoxin toxicity actually look like? And that's a complex answer. There can be too much vagal tone, which would be a slow heart rate. There could be too much automaticity of heart cells, which could look like a fast heart rate. There's the potential for electrolyte abnormalities with sodium and potassium moving in and out of cells. And what that means is there's no prototypical presentation of a patient with Digoxin toxicity. So without the right clinical context, it can be a difficult thing to diagnose. But in this patient, we know what he took and we know he took too much of it. So we have to think about how are we actually effectively going to treat this. In toxicology, there's one treatment that we do for everybody, which is called supportive care. And I'm going to keep that very broad. But then the second thing we have to remember is that Digoxin has an antidote, and it's called Digibind.
Okay, great. That was a lot of helpful information. Now let's recap the situation and what the cardiologist said one more time.
Oh, thank God. Please help me.
So that's what happened.
Started feeling faint on my way into work. I called my cardiologist. He said to find a way to keep my heart rate up and call 911.
That's a grumpy timeout right there. What did we just learn?
We just learned that patients with Digoxin toxicity present differently.
Yeah, so the cardiologist just hearing, hey, I took too much of my meds and saying, keep your heart rate up is a little bit reductive.
And it's kind of strange that he didn't mention the antidote once.
Yeah, that probably is going to become important, but hopefully they get there on their own.
Oh, yeah.
Hey, you thinking what I'm thinking?
Milligram of epi.
Hey, you thinking what I'm thinking?
Milligram of epi?
No.
Guys,
All right, Larry. We were gonna give you some meds to keep your heart rate up while we get you to the hospital, all right?
do what you have to. I can't keep this up.
Yeah. All the way up. All right, you're gonna feel a little pinch. Okay.
Okay, let's slow it down. Wait.
You know, if I gave my patient 1 milligram of IM epinephrine and they collapsed immediately afterwards, I would take a moment to be introspective on if I picked the right medication.
Huh. I would just slap him.
Hey.
His heart rate must be dropping.
Hey, Larry. All right, you have to keep moving.
What'd I tell you?
Okay? Okay. Keep moving. Okay. It's gonna be 8 hours until his body metabolizes the digoxin. Until that happens, he has to keep running
We gotta pace his heart.
while he's running.
Hey guys, you gotta do something.
I got an idea.
All right, so let's just recap real quick the treatment modalities we've chosen in the pre-hospital setting. Number 1, 1 milligram of IM epinephrine. Number 2, a little slappy. And number 3, we now think we need to pace the patient.
I love the knowledge base that this resident is bringing to the table. I mean, he knows the half-life of digoxin.
It's gonna be 8 hours until his body metabolizes the digoxin.
I mean, yeah, kudos to that. But shouldn't he be thinking about if there's a medication we could give that is the literal antidote to this particular toxidrome?
I don't really know about that, but I do know that we'll be running these blocks for the next 8 hours, and I hope our patients back at the hospital are okay.
Can't keep this up for much longer.
So you're almost set.
So, what is this?
Defibrillator.
Now that you're staying in place, we can send a continuous charge to your chest, okay? It'll steady your heart rate long enough for us to get you to the hospital.
We're good.
All right, Larry. Here we go.
Okay.
Turning it on.
Hey, whoa! Give me a hand.
Stop. I know this is fiction, but it's getting so medically inaccurate. It's viscerally offending me. I mean, number 1, why are we in a gym? How did we get to a gym? I mean, we have an ambulance. Why don't we just go to somewhere like, I don't know, a hospital?
Yeah, and number 2, you have the correct equipment. Put the 3 heart leads on the patient, as well as the defibrillator pads, and then you can pace the patient.
Yeah, and did you notice number 3 over here? What buttons is he hitting here? He's hitting the buttons that would make it so you can shock someone's heart, defibrillation, which is not good in an awake patient. You need to use that section below where he's looking, the pacer section, to pace the patient.
Yeah, so is anyone shocked that when you shocked the patient, that they collapsed while running on a treadmill? I'm not.
Yeah, let's take a step back here. Is this even the right treatment for a digoxin overdose? No! Get him to the hospital and give him some Digibind, please!
What happened?
We need you to get back on the treadmill.
What?
Yeah.
No.
Your heart rate is still dangerously low. You have to keep running to keep it up.
I can't.
Hey, Larry, you have no choice. Come on. Larry, come on. Come on.
Okay, just stop slapping me.
Oh my God, please stop slapping me. I would rather die than get back on that treadmill.
All right, now come on, give me a hand. Oh. Give me a hand. There you go. Take it up to a 5.
5.
The pads couldn't make good contact with the skin because of the sweat. It was not your fault.
I gotta call Med. Get an attending.
Thank fuck we're calling an attending right now.
I thought that they should have probably done that at the beginning when he collapsed in the street, but you know what? Second best time, right now.
I mean, this might be the 3rd, 4th, 5th best time, but you're right. We learned from our mistakes. It's time to get some help here.
I called 10 minutes ago. When is he gonna get here? Try to hurry it up. It's gonna be an hour until the attending gets here.
I'm so curious who he was just talking to on the phone right there if it wasn't the attending.
Well, judging by the structure here, this is an academic emergency medicine place. So I can safely assume the attending probably handed the phone to another resident to talk to.
Yeah, either that or it's like, scribe, speak for me.
Yeah, because right now, actually, what do you think's happening in the ER?
I wonder if there's those fancy bougie catered lunches happening for the attendings.
That's the hour. He's like, I'll come help. I totally come help. But I got to get some of that fancy pita bread that they're giving out, and I'll be there in an hour.
Yeah, this tiki masala ain't eating itself.
Yeah, somebody's got to eat it. Also, right now, if I remember anything about my residency experience, there are a bunch of attendings that are like, I will not see a single patient by myself. Get that resident back here this minute.
Yeah, call me when everything's done. I'll come in to make sure that we need to order 3 more tests. Thank you.
What if you paced him internally?
Push a wire into a man's heart while he's running on a treadmill. Are you insane? You serious?
Do you have a better idea?
If I push the wire too far, it'll puncture his heart, kill him on the spot. No, the best option is to wait for backup.
No, look at him. We do not have time. We need to pace him internally.
April.
Come on, you can do this. I'll help you.
Okay, so the feedback for that, TLDR, don't do that.
Yeah, not a good idea. Right now they're pacing externally, which is using the pads, and they say that the only thing they can do next is to pace the patient internally, which is a very invasive procedure and a dangerous procedure. It's not something you could even do when someone's running. It's not something you would do in an environment like a gym. And also, it's illegal to do without an attending present. So this is not a good plan. I hope they don't do it.
Yeah, but I've been that nurse before. Just come on, let's do it. Attending's not here, but we can figure it out. So,
You're just loving the chaotic energy. We're in the gym. Let's do it. Let's go for it, baby. Let's make the medicine happen.
Let's make some memories.
Make some memes at the gym.
Why is it taking so long?
He's starting a little wire into your heart. It's a delicate process. Just try not to tense up.
There's something moving in my arm.
You mean your chest?
No, my arm, my left arm.
Okay, you must have overshot the vena cava. You have to retract the wire and start again.
What? Start again? No, I can't do this anymore.
Larry, just hang in there, okay?
No, I can't.
You gotta keep running, Larry. Larry, hang in there for me.
That man just said, boop, I'd rather die.
Yeah, I can't reiterate this enough. I would rather die than continue exercising in this moment. Thank you. Boop!
Hey, Larry. No. Don't do this, Larry.
Finally.
Hey, help me out, man.
Fire back him.
All right, I'll get on his chest.
Heart rate's 30, he's not circulating.
Retract the wire and start over.
So we're going to continue doing the internal pacer now that the patient's also in cardiac arrest? All right.
Oh.
He's been down too long. You gotta hurry.
Hey, I'm stuck in his neck, and I can't advance the wire to his heart.
Heart rate's down to 20.
This is one of those moments where if this was me in this situation and someone said the heart rate's around 20 in the middle of doing CPR, I'd be like, no, it's actually about 100 because I'm doing CPR right now. Stop looking at the monitor, please.
Steve, take over for me. Okay, I can feel the wire. It is stuck. Okay, I'm gonna turn his head and see if that expands the opening. And when I do, see if you can push the wire forward, okay?
Okay.
All right. 1, 2, 3.
Full compressions. That's the PVCs. We're in. Pacing them now.
Nothing. Take it up to 100.
100. I don't understand. It won't capture.
Come on.
Pressure's climbing.
Just breathe, Larry. We're taking you to the hospital.
Let's get him on a journey.
Fern, I'm curious. Have you done a lot of internal pacing in your career?
No, never.
So, would you be comfortable supervising a resident on doing this rare procedure and troubleshooting it when it's not going well?
Oh, yeah, 100%. I love telling residents what to do.
Oh, so like from your perspective, overall, like, job well done.
Yeah, I mean, who needs the attending? Let's do this.
True. They're just having lunch.
Yep, let's make some memes.
Let's make some memes. Well done, everybody.
How's he doing?
Dr. Latham was able to implant a permanent pacemaker. He should make a full recovery.
Thank God.
He also said that given the circumstances, it was a very impressive save.
Also, He wanted me to tell you that this was just a horrific case. You did everything wrong, nothing right. You killed the patient, and he has already reported you to the state medical board.
But good job, cardiologist, for putting in a permanent pacemaker for a temporary problem.
Yeah, it's always good to put in permanent solutions for overdoses.
Yep.
Oh, thank God.
I am really glad that they put that nurse there at the end talking about how great a job they did, because I was getting a little worried there that maybe they had super messed this guy up.
Yeah, it did kind of feel like that scene was there for us dumb normies of like, no worry, don't worry, don't worry. Another person said they did a great job.
Yeah, she really put that lipstick on this pig.
And it's a beautiful pig.
Prize pig.
So I think when we take a step back from this episode, a lot of stuff happened. I find that there's just times when we're watching these that it really reminds me, because of the inaccuracies, that you're watching a television show. For me, it was ending up in the gym. I loved watching the extras, seeing what they're doing. They're on a treadmill trying to do a procedure. It just really pulled me out of the show, and I loved it.
Yes, same. I mean, I loved the therapeutic slapping.
Lots of slappies.
I loved the medical lingo that no one uses.
Fibrillator. Yeah, where they almost have the right term, but then you just hear the guy say fibrillator instead of defibrillator. I love it. It's cute. It's naive. It's an enjoyable thing. So any final takeaways as we take a step back from the actual episode?
I think, in all seriousness, something to consider for either the layman or the medical provider, toxicology. There's a poison control center in every single state, free 1-800 number that anyone can use.
Yeah, just keep that in mind. So for the paramedics, for the doctors taking care of people, for people at home, if you have anything scary like this happen, please start with poison control, because you know what they're not going to say is the way to treat this? Running the streets of Chicago. All right, well, thanks everybody. We'll see you in the next episode.